Good afternoon, everyone. My name is Jackie Leiser. I'm a manager with the CAQH core team, and I want to thank you all for joining us this afternoon for our Health IT Policy webinar, where we'll take a quick look at what's to come in the year ahead. We're joined today by Mike Phillips on the core team and Melissa Speck from CAQH Public Affairs to help walk us through this topic. Before we get started, I do want to go through some quick logistics. Today's session is being recorded. All attendees and registrants will receive a link to the recording after the webinar. Your microphones will be muted during the webinar, but if you do have a question, you can go ahead and submit it via the question panel at the bottom of your screen. If you hover over the bottom of your screen, you should see that Zoom menu, and the third or fourth option is Q&A, and feel free to submit your questions at any time during the webinar, and we'll have some time for a discussion at the end. Looking at our agenda, we'll start with some introductions, and in just a second, I'll have Mike and Melissa introduce themselves. Then they'll be discussing political landscape and 2024 priority and moderating topics, and we'll wrap things up with a discussion. With that, I'm going to turn things over to Melissa, if you want to go ahead and introduce yourself.
Great. Good afternoon, everyone. Thanks for joining us right after lunchtime. I am Melissa Speck, and I am the Senior Director with Public Affairs here at CAQH. And by way of background, just real briefly, I have spent my entire career in policy and regulatory government affairs types of activities, spanning both the provider and payer side before joining CAQH about a year ago. And with that, I'll turn it over to Mike.
Hey everyone, thanks for being here today. I'm Michael Phillips. I'm an associate director on the core team. I lead our value-based payment efforts and contribute to our policy work as well. Similar by way of background, I spent a lot of my career in academic medicine, running quality improvement, but also contributing to policy work at institutions like Partners Healthcare, Massachusetts General Hospital, as well as in the private sector and value-based care implementation. So happy to be here today, and without further ado, I'll pass it back to Melissa to kick us off.
Great. All right, so we thought we would kick off this afternoon with a little bit of a level set with regards to the political landscape that we're already engaged in and operating in. And Sarah, if you can go to the next slide. So there's a lot going on as 2024 is underway. In case you haven't noticed, the election cycle has already kicked in. And so from that vantage point, we're going to see the elections take and kind of monopolize a lot of the airspace. And that's because of the potential outcomes with respect to the election and any administration change that could or could not come into play. No crystal balls here today, just the facts with respect to election cycles always impact and cast shadows. Key to that with respect to the election cycle is what we call the Congressional Review Act and its impact on regulations, how the Biden administration, as they're continuing into this year, use their administrative authority, and then the stability of agendas, depending on, again, those election results. In addition to that, the environment that we're operating in, as you've seen, we still have a lot of stalemate as it relates to the divisiveness of within Congress, as well as we've got a lot of health acumen, institutional knowledge, if you will, that have already announced that they don't intend to seek re-election, they have resigned or otherwise. So those open seats or changes in seats are going to lead to a vacuum with respect to health leadership. Again, given the slim majorities, we don't have any real concrete mandates for Congress to act, particularly in the healthcare space. And just as we echoed with the 2024 election cycle underway, there could be significant dynamic shifts as we embark into 2025. There is opportunity, though, with all of that to break through with respect to some bipartisan issues, things that we've heard a lot of at the tail end of last year and coming into this year. Range from mental health to substance abuse, veterans health, cancer research, continued efforts on pandemic response, and then, of course, healthcare affordability. And then finally, in addition to the federal elections, we also have state elections that will impact and shuffle priorities. It means that there'll be new legislators in 2025. and that we will see differing actions and priorities based on things at the state level versus what's happening at the federal level. Next slide. So I mentioned the Congressional Review Act. So that comes into play particularly around presidential elections. And you'll see we're right now technically within the final budget release timeframe. We'll see where that goes, given we still have a lot of spending and other issues that Congress is trying to resolve. We then move into April-ish timeframe, give or take. And that is when we expect a lot of key final rules from the administration to be released. And then, of course, the fiscal year ends in September of 2024, and that starts the rulemaking whereby it is subject to the Congressional Review Act, wherein Congress takes and has the ability to take and assess the regulations. And so we anticipate a lot of activity, and I know Mike's going to be getting into more detail on some of those regulations that we're looking out for. Next slide. And then the last thing I want to leave before I turn it over to Mike is in regards to the House and Senate. We talked already about that there's slim majorities, that we know of a number of longstanding congressional representatives that have already indicated they do not intend to return in 2025. And you'll see on the slide that the balance of power within the House, we've already seen approximately 40 individuals, and in the Senate, 6 that do not intend to return in 2025. And so obviously with respect to the elections, there could be a significant shift with respect to majorities, given that neither party is likely to achieve a mandate. And again, loss of health acumen is a given. Next slide, and I think this will now be Mike.
Yeah, thanks, Melissa, for that great overview. And as some in the chat referenced there, priorities are constantly shifting as well. And it presents a very complex atmosphere. And someone in the chat put forward prior authorization, Med Advantage, AI, and these are also on our radar. And I hope to dive a little bit deeper into that in the next several minutes. So as you outlined, though, Melissa, the context that we're operating in can be quite precarious, and but despite the tumultuous nature of it, 2024 has already been marked by the release of landmark regulations with really some more promise around the bend. And many of these directly affect the priorities and the impact of the core initiative on the industry. So I'm going to speak to you all from that perspective. Sarah, next slide, please. So starting off with a recent big splash that has likely dominated much of your time speaking to those on the call is the interoperability and prior authorization final rule, which was released on January 19th. I'm not going to use this time to restate all of the requirements, which you are all likely familiar with. But in brief, this rule established the use of Firebase APIs that assist with care continuity and data sharing and the streamlined administration of prior authorization activities, including decision timing or determination timing. CORE responded to the proposed rule and is still actively evaluating the final inclusions, but CORE is participating with internal resources both within the CORE team as well as in the larger company at CAQH, as well as external resources to aid in demonstrating value of implementation and to help demonstrate a return on investment of implementation. So more to come on that. The next box here, and recently CORE, with the assistance of the public affairs team and some of our valued external partners, responded to a proposed rule operationalizing aspects of the independent dispute resolution process, a component of the No Surprises Act. In it, the Tri-Departments and OPM added a proposal requiring the use of CARCs and RARCs to communicate certain provisions of the No Surprises Act. As some of you may know, CORE has a long-standing HIPAA-mandated operating rule and process defining the CARCs and RARCs that must be used across 4 defined business scenarios. Though currently in the CORE defined business scenarios, price transparency is not among these, it is being evaluated by our long-standing CORE participants. Given CORE's role in this space, our team has requested a meeting with the Tri-Departments and OPM to coordinate and align around any guidance that's released for use of remittance advice in support of No Surprises Act provisions. So that comment letter is available on our website as well for those who would like to review. The third box here is CORE. We at CORE are anticipating the relatively imminent release of ONC's HTI-2 proposed rule. This isn't to be confused with HTI-1, which was a landmark regulation that, among other impactful finalizations, codified the use of USCDI version 3. HTI-2 promises further proposals to advance interoperability using electronic standards, and we further anticipate additional proposals surrounding prior authorization requirements. As Melissa said before, without a crystal ball, I'm not going to prospect too much on what will be included, but know for all you in attendance that it's on our roadmap, and our team is going to be reviewing the proposed requirements as for potential impacts to operating rules and other initiatives being undertaken by our group. Next slide, please. So in the first box here, I'd be remiss at this point not to mention the anticipated release of an interim final rule that would mandate several new and updated core operating rules under HIPAA. Rule sets for eligibility and benefits, claim status, and payment and remittance, as well as connectivity, were recommended for adoption by the National Committee for Vital Health Statistics, excuse me, on June 30th, 2023. The ball is now in CMS's court to issue an interim final rule with comment period. And we are eagerly awaiting that release and are looking forward to that. Just of note, this rule set, to the best of our knowledge at CORE, includes the first operating rule exclusively designed for the administration of complex attribution methodologies and value-based contracts. This rule is the CORE single patient attribution rule, which leverages the X12 eligibility and benefits transaction, the 270, 271 transactions. Just as a general invitation to those on the call, the staff at CORE is available to engage about the contents of these operating rules, as well as their industry benefit as we prepare for this interim final rule and after it is released. We're similarly awaiting the finalization of attachment standards that were originally proposed in December of 2022. The proposed rule named the X12 275, as well as the HL7 CCDA, as attachment standards for claims and prior authorization. Right now on the long-term agenda, it's anticipated that this final rule will release this year, potentially with changes to address overlap with other regulations, such as the aforementioned interoperability and prior authorization. I believe that the current long-term agenda puts this as a Q2 or Q3 release, but CORE will continue to monitor, CORE and Public Affairs, I should say, will continue to monitor for any potential changes to that timeline. And lastly, on this slide, we continue to monitor the Federal Register for requirements around the No Surprises Act, Advanced Explanation of Benefits. Presently, this is looking all the way out into Q1 2025, but we are eagerly awaiting clarity around this complex requirement for covered individuals. Notably, CORE expects that the responses to an October 2022 request for information from the departments in OPM will be referenced to inform the contents of this rule. CORE did respond to that and was supportive of existing and emerging electronic standards, but did caution against the potential costs and time burdens associated with implementation, particularly for small, rural, or otherwise underserved providers. Next slide, please. So Melissa and I are kind of tag team this slide a little bit, but there are other ongoing priorities and factors that are shaping CORE and Public Affairs policy roadmap for the year ahead. First on this are the statutory and calendar-based regulatory release periods. So just of note, CMS and other agencies abide by annual or statutory rulemaking calendars, as you are all likely familiar. But one thing that we've observed over the past several years is that these rules are increasingly being used as an avenue to propose items relevant to health equity, value-based care, as well as the adoption of new technologies and standards. So though these rules have always been part of our review cycle, CORE has taken additional time to understand the impacts of these rules on not only core operating rules, but other solutions that we bring forward to the industry. Second on this list is the advancement of health equity. which is a continued focus, was a major focus for CORE in 2023 and a continued focus beyond. CORE participating organizations acted on equity by drafting operating rules to standardize the collection of sociodemographic factors during the 2023 rule development cycle. But we're not alone in this activity. And CORE will continue its engagement and monitoring of federal, state, and other consensus-based organization actions to advance the documentation and excuse me, the documentation of and intervention against health-related social needs that can harm health equity. If just of note, in fact, immediately prior to these slides being finalized, CORE did issue a response to a Medicare Advantage request for information of the benefit of collecting health-related social need and sociodemographic information to incorporate into value-based care methodologies. So we are still prioritizing this and still acting on it whenever possible and whenever relevant. So let me pause there. Melissa, if you want to come and speak to us a little bit about workforce challenges as well as SCOTUS rulings, I think that you can benefit us and be very informative.
Wonderful. Thank you. So just briefly on the workforce challenges, I don't think this is a new issue, if you will, but it continues to increase in terms of impacts, particularly as we've gotten post-COVID and are coming out of the pandemic. And we've seen a lot of exodus as well, but it is expected that it will be an ongoing priority, particularly around the potential for Congress to take some actions. And then the last one that we have on this with respect to other priorities or impacts, moderating factors that are impacting all of the work with respect to health policy and interoperability and all of those things is SCOTUS has taken on and just recently heard oral arguments related to the Chevron case. And without boring folks, the Chevron is a ruling that's had longstanding precedent, and it, in essence, takes and defers to agencies and rulemaking entities with respect to their interpretation, particularly around things where the statute itself is not clear in its directive and or expectation. This case actually challenges that. And by the way, disclaimer, I am not an attorney by fact, but just so you know, this is not in any way trying to legally interpret what the case is about. But as an overarching summary, it is challenging the Chevron, and it could have significant impacts with respect to the regulatory and rulemaking process as we see it today. You know, from one extreme to the other. And I'm sure if any of you have read some of the synopsis of the oral arguments, there seems to be some sentiment around the Supreme Court leaning one way, mostly a read on that, hey, Chevron might be over and done with. It'll be interesting to see if that actually comes to be, because again, the ruling or the challenge was on the scope of authority and who has the right to interpret it, especially if there's if there is silence in the actual underlying statute. But we're waiting anxiously to see, because again, it could potentially have a significant impact, or it could have none, because they could rule very narrowly. But it is an important factor to call out as we're operating in all of this wonderful time. And having so many influences that impact our day-to-day rules and things that we take and watch.
Certainly a dynamic environment, Melissa, particularly with national and geopolitical influences. Great.
And I think now, Michael, are we going to open up for any discussion?
Yeah. Sarah, if you want to advance one more slide here, as we open up for discussion, I just want to share, you know, CAQH Core and Public Affairs are really leaning into this opportunity to work together and identify and engage with topics that drive interoperability and overall just simplify healthcare at the end of the day. So I'm very fortunate to sit here with my colleague Melissa today to outline these high priority topics and impactful topics. So with that being said, let's open it up for discussion and see if there's any questions from the audience.
Yeah, thanks, Mike. Just a reminder for the audience, because we haven't received questions through the presentation just yet. If you do have a question for either Mike or Melissa or both, please feel free to submit them using that menu at the bottom of your screen, using that Q&A function. But in the meantime, we have some discussion questions ready for you both while we're waiting for submissions. And the first one, I think we're going to start with you, Melissa, because it kind of builds off of the Chevron case that you were talking about just a minute ago. Could you talk a little bit about how specifically the Supreme Court ruling on Chevron could impact current and future regulations?
Sure. So I think, again, the devil will be in the detail with respect to how the Supreme Court actually rules. But again, because the question at hand is really around if the legislation or enabling statute is silent, what does that mean in terms of the regulating entities, the rulemaking bodies, taking and utilizing their own experts or tapping into subject matter experts or others to help in providing clearer definition, interpretation, etc. And so if the Supreme Court would come down and take and say, no, we're going to abandon the Chevron statute, then and move past it serving as precedent. It could require that we see Congress being more specific in their legislation and laws that are passed to ensure that there is no ambiguity. It could mean that in the legislation that Congress actually has to then delegate that authority over to an administrative agency to be able to make clarifications or interpretations or otherwise. So it really will depend on how far the Supreme Court goes in its ruling. If it in fact rules in some way that would abandon the deference that is currently given to an agency. But again, it could potentially, if they would just go away with it, but not leave any clarification or recommendations, it has a potential to take and say, hey, we need to look back at any of these regulations. I doubt that'll be the case. That would open up Pandora's box, if you will. But I do believe it will be an interesting one to see the ruling once it comes out. And from a timing vantage point, they are in through July, and most rulings, for those of you that watch it, those rulings usually come out in the June-July timeframe before they recess. So it's anticipated that is likely when we would see any ruling on it.
Great, thanks, Melissa. I have a question for Mike. Can you expand on how CORE is reviewing and intends to act on the interoperability and prior authorization final rule?
For sure. So as I shared earlier, CORE is in the process of evaluating all the potential impacts of this, but really using it as an opportunity of the core of the structure of the CORE initiative, if you will, to partner with our external friends throughout the industry to really put together and demonstrate the ROI of implementation, the value of implementation. There's very complex regulation. So being able to bring together our multi-stakeholder initiative and really identify the components of the implementation guides and other operational considerations is a great opportunity to really demonstrate what can be measured and what should be measured in some circumstances in order to demonstrate, I'm just saying the same words over and over again, I'm sorry, in order to demonstrate the value of implementation and the overall impact that this will have on the industry at large. I think that's also safe to say that CORE uses this as an opportunity to review our operating rules in this area as well, to identify the potential overlaps there and the overlaps and how these items can complement one another. That is not to say that not to imply any of application or anything of the like, but it is an opportunity for us to revisit our structures as well, and understand what impacts that it has on things that have already been put out by our participants and our groups. Excuse me. So yeah, thank you for the question. Very good question.
Great, thanks, Mike. Just give me 1 second here. I'm just taking a look at the questions that are coming through. All right. Mike, we have a specific question about the 278 regarding if EDI vendors and states are required currently to support, receive, and process this transaction.
So the 278 is a HIPAA mandated transaction. And I'm reading between the lines a little bit. The current interop and prior authorization rule offers an exception to the 278 to those implementing the API. And that's the finalized requirement of that rule. But that is only to a subset of impacted health plans and payers. Med Advantage, Medicaid fee-for-service. I don't need to list them all out. So this is to say that any covered entity, HIPAA covered entity, is required to support this transaction. The regulation provides an opportunity for those implementing the API to carry it out not using the 278 transaction. Now, I have, like Melissa, I'm not a lawyer, and definitely recommend that this be discussed with your legal departments to understand the exact impact of this exception, and to identify if you are one of the impacted entities under this requirement. But very simply, the 278 is a HIPAA mandated transaction, and if this is regarding the exception or the exception process under the interop and prior auth rule, I recommend looping back with your legal departments just to understand exactly what that impact would be.
Great, thanks, Mike. We only have about a minute left, so I do want to thank everyone for joining this afternoon. I saw a few questions coming in at the last second. Well, we don't have time to answer all of them live. We'll be sure to take a look at them offline. Also, if you have any questions that come up after you think about what you heard today, please feel free to email our team, core@caqh.org, and we'll make sure your question gets to the right person. Otherwise, I just want to thank you all for joining. And I did see some questions come through about the recording for this presentation. Just a reminder, we will have it available on our website, and we're going to send an email out to anyone who registered with that information for you to easily access it. All right, and with that, thank you again for joining us, and have a great rest of your afternoon.